Assalamu alaikum everyone. So I'm going to talk about some more examples of hair fall from real life scenarios. In the last part of presentation, we talked about different types of alopecias. We talked in detail about different diagnostic features on trichoscopy, and probably if you listen to that presentation, it would be quite easier for you to diagnose these upcoming examples of hair loss. And if you haven't gone through that presentation, I would suggest you open up that presentation on trichoscopy part 1, and then you memorize, or at least you revise, or at least you go through the diagnostic features of different kinds of alopecia so that you can instantly diagnose these examples that I have just put. So my own patient came up with this thinning on the scalp. And what do you see on the trichoscopy? Giving you a moment. Book the diagnosis. Okay. What was it? So this was example number 1. Let me know in the comments, what do you think about this disease? And then we can have discussion about it. Picture number 2, young patient, whitish patch on the scalp, and he underwent some treatments also. He was, I think, 15 to 16 years of age, and he underwent many treatments for alopecia areata, and then he came to me, and the picture was hilarious. I had to explain to the patient that there is no hope now. Probably you're not going to have your hair growing back from this patch, bald patch. So what do you think about this example number 2? Case number 3. Case number 3 is also a patch of hair fall in the middle of the scalp, and on trichoscopy you see these thin hair, and the proximal hair are whitish. Proximal part of most of the hair are whitish. But focus on the caliber of the hair in this picture, and also the significance of this white area of the hair. All right. So what do you think about case number 3? And then case number 4, where there is also a patch of hair loss. And then on trichoscopy, the pigment that you see on clinical picture is enhanced in dermatoscopy or trichoscopy. You see these different white dots, the empty follicles, pigmentation around the follicles, and this peripilar scaling. Okay, so appears like an inflammatory disorder. I've given you a clue. So let me know, what do you think about case number 4? All right, case number 5. Also, loss of hair from the middle of the scalp, and on trichoscopy, lots and lots of globules and dots and globules, dots and clots of pigmentation on the scalp with empty hair follicles, no follicles. Some of the hair follicles are having scaling in them. And then focus on this, the hair density is pretty much reduced. Also seems like an inflammatory disorder. Okay, another case, I would label it as case number 6. If I'm right, let me go through also case now. Okay, so case number 6, patch of alopecia, and then on trichoscopy, majority of the follicles are showing black dots. So what is it? हमने इसके बारे में बड़ी डिटेल से बात की. केस नंबर 6, ये मुझे बताएं क्या है. All right, case number 7. You see these hair follicles. There is enlargement of the hair follicles, and then there is obviously pigmentation around. On the skin, can you see the blood vessels? I can see some erythema over here, but no particular blood vessels. Okay. So another patient with hair thinning on the top of the scalp, and on trichoscopy, these hair. These are maybe forced through hair, broken hair. So let me know, what do you think about this case? This was case number 8. Case 9. What do you think about it? Scarred area with no hair follicles or hair, probably as a result of some treatment that he might have taken. Case number 10, diffuse thinning of the hair. What do you see on trichoscopy? Case 11, the coiled hair. Case 12. All right. So, ये आप मुझे बताएंगे कि 12 केसेस में आपने क्या सोचा, ताकि उसके ऊपर मैं भी दोबारा से अपना फीडबैक दे सकूं. Recently, we have tried in collaboration with some people, IT people, we have come up with a solution that not everyone is good at dermoscopy or trichoscopy. But if even if you're not good at it, you can at least capture an image, because capturing an image is very, simple. It's quite simple. You just put the scope on, you put your phone on, and then you can capture. It's as easy as it seems. So once you have captured the picture, you don't know what exactly it is, because sometimes we are not well versed with the trichoscopic or dermoscopic features of some disorders, and then maybe we don't have time to go through all those features, and the mentor is not around that we can always send the picture and talk about the diagnosis. So what you can do with ease, with very little time, that you can put up the picture into a software. This is Skin Check Pro, a prototype of an application that we have just built with so much effort and resources. This app is already there on my YouTube channel with the name of AI, Artificial Intelligence in Dermoscopy. So if you browse over here, this window opens up when you touch that enabled link. This window opens up, and then when you browse the files from here, you can put up your picture of interest that you have just captured, and you're worrying about the diagnosis of that picture. Once you feed that picture into the system, it instantly comes up with its options of diagnosis. Like, it takes maybe 1 or 2 seconds, and then it gives you the options, the diagnosis which AI thinks are pertinent in this case to think. You can always chat with the AI guy over here. You can ask what are the diagnostic features of this disease. Why not? You talked about that disease in particular. How much chances of improvement are there automatically if we don't go for treatment? What treatment options are available? Can the patient wait for treatment, or there are chances of disease getting worse? So these are the questions which you can ask with the AI on this app. If you have not yet gone through this app, please open it up and see what it means to you, and then let me know if you can really, we have trained this application on certain disorders. For example, we have trained it on actinic keratosis, basal cell carcinoma, squamous cell carcinoma, melanoma, melanocytic nevi. If you feed pictures related to these disorders, then it comes up with the related answers. So हमने इसको अभी सिर्फ इतने ही disorders के ऊपर train किया है, because we need thousands and thousands of images in order to train AI on some hair disorder or on some dermatological disorder. We need so many pictures pertaining to one disease. So we are working on it. We are trying to train it on more and more disorders related to dermoscopy, and we are trying to build another app on trichoscopic as well, which you will see in coming future. So this was all from my side related to trichoscopy. Hope the presentation was understandable, and you understood most of the features that I talked about. And hopefully, after this presentation, you will be able to diagnose common causes of alopecia on trichoscopy, and you will be confidently diagnosing some disorders. If at all you feel difficulty, you feel free to come back to me. You can send me the pictures, and you can, we can have a discussion about the diagnosis. So this is all from my side. Thank you so much for listening to the lecture, to this presentation. And you can always write up your comments in the comment section. And जो मैंने आपको cases दिखाए 12 cases, तो उनके बारे में भी जरूर बताएं कि what do you think about diagnosis of those 12 cases. From my side, this is all. Thank you so much. Allah Hafiz.